Good evening, members of the Health and Adult Social Care Committee, officers and members of the public. Before we proceed to the main items on today's agenda, I'll hand over to Samina Richardson, our Democratic Officer, to go through items 1 to 4.
Firstly, please note that this meeting of the Health and Adult Social Care Overview and Scrutiny Committee is being audio recorded by the Council for publication on the Council's website. Please could I remind councillors and officers to use their microphones when speaking. The meeting may also be audio recorded and or filmed for live or subsequent broadcast by members of the public, although the chairman has ultimate discretion and may hold any recording or broadcast should she feel that proceedings are being disrupted. Please note that this meeting room is fitted with an induction loop for the benefit of hearing aid users. Hearing aids should be switched to the T setting. There are no scheduled fire alarm tests. If the alarm should constantly ring, please follow officers out of the building by way of the nearest available signed fire exit route and make your way to the ground floor of the multi-storey car park. If you should need any specialist assistance, please let a member of staff know so they can arrange for this to happen. Finally, please could mobile phones be turned off or switched to the silent setting for the duration of the meeting. Thank you. For item 1, apologies, we've received apologies from Councillor Nick Geary. For substitute members, we've received notification from the nominated representative of the Christchurch Independence Group that Councillor Paul Hilliard will substitute for Councillor Nick Geary. We haven't received any declarations of interest. Do members have any declarations of interest to make for items on the agenda?
Thank you. Okay. For transparency purposes, I'm my teeth in. Sorry, I'm a governor of Dorset Healthcare University NHS Foundation Trust, but also on the agenda this evening on item 8, which is the Dementia Services Review. I actually work for the Alzheimer's Society and work for the Memory Support Advisory Service. So I'm going to actually leave the room for that. I know it's an information only, but I just don't feel it's right to be in the room when that's being discussed. So I will leave for item 8. Is that okay? Thank you.
Do we have any other declarations of interest? No. I have a copy of the minutes from the last meeting on the 2nd of September for the Chair to sign if the committee agrees. Yeah, agreed. And a copy of the action sheet for members to note. Are there any comments on the action sheet? No, so is that agreed? Thank you. We've received no public questions, petitions, or statements for this meeting. Thank you.
Thank you. We'll now look at item number 6 of the agenda, information circulated between the meetings. And members are asked to confirm whether further scrutiny is required on those items and the agreed method for this to take place. Sally Sancroft is available to take any further questions. Oh, there you are. Sorry. Okay. So this is on the item about the GP surgery closure, and I'd asked some questions here just because I was just interested in how we'd received the money sort of a decade ago for services to be delivered in the area, and just I was just interested in how things had developed over time and how the building had changed hands and changed use, and what will happen in the future with the services that are delivered there at the moment. And wondered if you could just give a little bit more background to that.
Thank you. Yes. So we actually think that this is quite a good news story for Dorset and for the residents in that area, because the Crescent practice has been operating out of what was known at the time as the Darcy Centre, which is Boscombe and Springbourne. And we've been quite concerned for a while about the underutilisation of the facilities there. So it hasn't been used to its maximum potential, and it's been, for want of a better word, by NHS Property Services, which was a transaction that happened nationally some time ago around community estate. And the good news story here is that there's been a change in policy from NHS Property Services, which enabled Dorset Healthcare to negotiate the transfer of that property back into the custodian of Dorset Healthcare. So as a result of the Crescent practice, which supports about 3,500 registered patients, but they also already use the Providence surgery practice as well, because it was a branch and it's only 0.2 miles away from the Providence surgery itself. That we've approved in the CCG, following the engagement with the registered patients, for the Crescent practice as part of a wider change programme in that area. They will be moving to Walpole Road, which is part of a strategic change to the way those services are being delivered in Boscombe area, which is obviously an area of high need for all of us. But what that means is that the Boscombe and Springbourne Centre, now it's in the hands of Dorset Healthcare. We've got local decision making about how we use Boscombe and Springbourne, and looking at the nature of the population there's been a lot of work with Royal Bournemouth Hospital about how we can deliver a service of excellence there for sexual health services and really maximise the use of the space in the Boscombe and Springbourne Centre, as well as making the GP services, by bringing them together, much more resilient, but also providing good access, because there isn't a problem in terms of parking, bus routes, and there is choice in terms of GP practices. So, having considered the feedback of from the patient survey, also the patient participation group which we're engaged with there, and being able to bring that property back into the hands of Dorset for local decision making, we think in the round it was a really positive move, and therefore we supported and approved that in the CCG.
Could I just ask one more question first? So at the moment there's a out-of-hours service at the weekends, which is available to, I think, anybody.
So it's still it'll be so it's moving to Walpole Road. So that still will be available as well.
Great.
Yes.
Okay. Thank you, Councillor Trent.
Thank you, Chair. I'm glad that there is still health use being made of it, but I am a little bit concerned that something which was being built and provided less than 10 years ago was within 9 years of that time sort of closed and falling out of use, and wonder whether there was a lack of joined up thinking at the time to provide something which could be replicated just down the road. So sort of asking what sort of measures are going to be taken to make sure that this is actually used for the purpose for a reasonable length of time and not change again in another 9 years?
I suppose two aspects to that. One is the programme of the Darcy centres at the time, because this was the Boscombe and Springbourne Centre was nationally funded for a national pipeline. There was a dictate in terms of how many Darcy centres needed to be developed in each of the areas. So there wasn't a lot of local decision making in terms of how we could influence that. Whereas now we've actually got as I mentioned before, the property is in the hands of local Dorset NHS providers, which enables us to shape the provision of that service and make sure that it's utilised to its full to match the needs of that local population. So we've always been working within a framework that was set out nationally and not been able to, even though we've attempted many times over the years to look at how we could utilise that space, we have had restrictions put upon us because of the fact we didn't own the property locally. So that's why we think this is a really good move, because it means that we really are going to be able to maximise the use of that space and services that are needed for that local population. And it's also a partnership, which I think is really good, between Royal Bournemouth Hospital and Dorset Healthcare Trust.
Well, hopefully it'll succeed.
Does anybody else have any more questions? Okay. I think in that case, I'd just like to thank you for coming and explaining all about the building. Thank you. Okay, so we'll now look at item number 7 of the agenda, the adult social care charging strategy. The purpose of this report is for the committee to be presented with the proposals for a public consultation on the principles of a new charging policy for BCP adult social care and to offer any recommendations to Cabinet. The officer presenting this item is Chloe Durrant.
With David Bitty and Peter Courage.
And after we've heard from the presenting officers, I'll give an update on the progress of the working group that was formed on the 22nd of July 2019 to provide test and challenge to this process.
Thank you, Chair. I'll kick off, if I may, but then Pete Courage, who's Head of Service Development for Adult Social Care, will talk in a little more detail about the proposals. And Chloe Durrant, who's a Senior Research Officer, will then talk about the proposed consultation. I think probably just helpful to remind this committee why we're looking to change the charging policy. Essentially, we've inherited 3 legacy policies from predecessor authorities, and there is therefore inequity in the way that we currently charge BCP residents. It's been therefore a priority for adult social care to harmonise these into a single BCP policy for adult social care charging. Charging in Bournemouth and Poole has been reviewed in recent years, and the charging policy for those 2 towns is actually not dissimilar. Christchurch is a little different and currently charges less than Bournemouth and Poole. However, I would point out that Dorset County Council had consulted on and were about to implement a review of their own charging policy, which they did once Dorset Council was formed. And had Christchurch remained with Dorset Council, it would actually be in receipt of adult social care charges very similar again to Bournemouth and Poole. However, for us as BCP, it is Christchurch that's likely to see the greatest impact as a result of these proposed changes. So we are proposing this change to charging really into equity and harmonisation. We think there may be an additional income for BCP. Very difficult to say how much because our client cohort changes from week to week, but between £40,000 and £60,000 is likely. That's relatively marginal given that our income from charging is over 20 million. So this isn't being done as part of an income-raising proposition, but more about equity and harmonisation. That's probably all I want to say by way of introduction, and I'll ask Peter Courage to talk a little more about the detail.
Good evening. So I'd like to start by just talking you through the kind of proposals that we were looking at, which we're presenting to you today. There were broadly 3 options, so if I refer you to point 12 of the report that you've received. Option 1 was essentially do nothing. So we continue with the 3 legacy charging policies, which, as David has already explained, is inequitable. Option 2 was to implement a full cost recovery model. And just to unpack that a little bit, what we mean by that is that the maximum charge for a service is the actual cost of delivering the services to BCP Council. So there's no profit that's being made. And it's really important to understand that only those who can afford to pay will pay. Option 3 was to adopt the legacy charging policy that's currently in Christchurch, which is a highly subsidised model and actually presents inequity in its own way. Of the 3 options, we viewed option 1 as not being worthwhile pursuing because of the inequity that it presents. Option 3 would create a new kind of inequity because, as David says, the 3 legacy policies have been reviewed at different times. The Christchurch policy is quite outdated, and so actually, even if it was looking at full cost recovery at the time, that's no longer the case. Prices and so on have moved on. So to present a kind of subsidised model at this point would actually provide a number of inconsistencies for us. Or option 2, which is our recommended, is to introduce the full cost recovery model. Now, in general, there are a couple of key charges I think it's worth reflecting here to committee. These are listed under item 16 in the report. Firstly, I'd like to just mention charges for out-of-area assessment. And these charges don't actually impact clients, but as we're looking at the whole charging policy as a whole, we wanted to include them here. This is essentially where other local authorities ask BCP Council to act on their behalf to carry out a review or an assessment, generally because that person's out of their area. And we're recommending a charge of £500 for that, which is broadly in line with similar charges elsewhere in the country. Then on deferred payments. Deferred payment, just briefly, is an agreement where a loan is secured against the value of an individual's property, meaning that they don't have to sell their property in their lifetime. Unfortunately, these direct deferred payment agreements have a heavy administrative burden, and so what we're recommending is that there are set-up fees, annual fees and termination fees. These are currently charged in different amounts between the 3 local authorities. So we'd looked to harmonise them, but here we'd only be looking at new deferred payment agreements. So anyone who's currently got one, we wouldn't be changing. Okay, so this is only for new people. Then we get on to 2 areas where there is quite a significant amount of difference, and probably 2 of the more slightly controversial areas. One is day centres. These are centres which provide opportunities for individuals to socialise and undertake social activities and help maintain the individual's independence. Over time, the prices charged in the 3 local authorities has moved apart, and currently in Christchurch, the charge is £24.70 for a half-day session. So these are all based on a half-day session, whereas in Bournemouth it's £35. So there's quite a significant difference. As I say, things have moved on significantly since the Christchurch policy was last reviewed. Then finally, transport. Transport for standard journeys for people going to day centres. There's a slight complexity here in that the pool charge for day centres includes an element for transport. So whether or not you receive or take up that transport, you are effectively being charged for it. And otherwise, the charges for those single journeys, as you can see, again in Dorset or Christchurch now, it's £2.76 a journey, and it's £10.50 a journey for Bournemouth. So the differences are quite significant. As I say, with all of this, you're only charged the full cost if you can afford to pay it. So I think that's really, really key. And we're talking about a very small percentage of the overall cohort, between around 3 to 6%. So it's not a big number of people that will impact. Then finally, I'd just like to move on to the consultation. Chloe's going to cover this in a lot more detail in 1 second, but I just wanted to draw members' attention to point 21 in the report. There we've stated that the consultation, which is going to run for 8 weeks, will likely start on the 6th of January 2020. I just wanted to flag that due to the day in Cabinet in December, for very obvious reasons, that being put back, that is likely that by the time this becomes a Cabinet paper, that 6th of January will probably be a week or so later. So just so that everyone's noted that. And I'm going to hand over to Chloe now, who's going to talk us through the consultation.
Thank you. Right, so I thought it might be useful just to give you some idea of what will be included in the consultation document, so the information that's going to be given to clients. And the idea is that all current clients will be sent a copy of the consultation document, a questionnaire, a post envelope explaining how they can have their say. So the consultation document itself will first of all explain the background and reasons for the change, so summarising what Pete has just gone through. It will then summarise each of the proposals, and for each proposal we will summarise what that service essentially is, what the situation is in terms of the charging across the 3 areas, what the proposal is and what the impact will be. And then we will also have a section about the help for those affected and further information, which will include things like drop-in sessions that they can go along to find out more information.
The principles for the document are that we keep it plain and simple language as possible, because it can be quite a complex area, so trying to get it in a way that people can understand. A clear layout. In the past, with similar adult social care consultations, we've had some really valuable feedback from Healthwatch and Dr Disability. They've consulted with their clients about the best way to lay it out to help people to understand. So we'll be using those principles this time. With easy read version available, that will be sent to anyone identified as having a learning disability and also available on request. And we can also provide translations in other languages, which we've been asked for before, and audio versions as well if needed. And in addition to the consultation document, there will be drop-in events for people to ask more questions. I thought it might be useful just to show you an example section, so focusing on the day centre element of the proposal. So first of all, we would have a summary of the service, as you can see there. So just explaining day centres are designed to allow adults of all ages to meet and socialise with friends, take part in activities and learn new skills. Support is also offered for personal care, eating and drinking. Then we will move on to the current situation, splitting it out between the three current areas and explaining what the current rates are for the full charge. So for day centres, as you can see, Bournemouth residents £35 excluding transport, Christchurch £24.70 excluding transport, and Poole residents £39 but including transport. Then we'll move on to the proposal itself. So for this one, to introduce one rate for attending a day centre based on the actual cost of providing that service. Currently that would be £35 for a half-day session, but that would only be for a small number of individuals who can afford to pay the full cost of their care. And then finally, for each section, we will explain the impact, and it's really just reiterating, as Pete said, that no one will be charged for services they cannot afford, that it's based on financial assessments about how much someone can contribute to the cost of their care, and no one's going to be asked to pay for more than they can afford. So yeah, that's really it. So we would do that for each proposal, so that's going to be repeated each time, taking each one in turn and just laying it out in a really clear way.
Thank you. That really explained clearly, I think, how the proposed consultation is going to work. Is there any questions? Councillor?
How do you carry out, or who does the financial assessments? Because one of the things that concerns me about most things where a charge comes in is that when you look at it, you know, a small differences in income can mean that someone suddenly drops off the cliff edge and pays the full charge. And I'm kind of wondering how this is done and whether it makes sure that there's a taper so that, you know, if someone's, you know, got a slightly higher income, you know, perhaps another £100 a month or something on a private pension, does that suddenly drop them off the cliff, so to speak, so they start paying the full charge rather than have it sort of well subsidised? What's the system?
Perhaps I can answer that one. We do indeed have a taper. It's very hard to say how many people pay nothing towards the cost of their care because it does change from week to week. At various times that we've sampled it, it's been between 25% and about 40%. At the moment, we think it's relatively low, and about 25% of our clients don't pay anything at all towards the cost of their care. And then with the exception of the sort of 3 to 6% that Pete noted earlier, everybody else pays a tapered amount. So many people might only pay a few pounds towards perhaps that cost of the £35 in day centres. So it does taper off. The financial assessments are done either by our in-house financial assessment team, who are based in Bournemouth, or the Stour Valley and Poole Partnership in Poole. A lot of those are done face-to-face and will take account of individual circumstances. Sometimes they're done by telephone if they're very straightforward. And in the case of this change, this proposed change to our charging policy, we would review all of our clients' charges before we introduced it. So we would want to understand if anybody did tip over into a full charge from a partial charge. So we won't just introduce it before understanding everybody's financial needs.
Thank you, Chair. Obviously, as you said, Christchurch residents will be affected most, and I understand why we're doing this for equality, harmonisation, but obviously this is expected to land 1st of October 2020. The council tax isn't harmonised, so the residents of Christchurch will feel, yeah, this is an increase. I know you've explained if we were stuck with Dorset, it would still be, probably the increase would have happened, but it's just understanding the consultation and the letters going to the residents, particularly of Christchurch, to say, to reduce the worry of this major increase. Certainly the travel is quite a major, and the day centre is an increase. So it's just really to understand how you would smooth that process, because it doesn't seem worth, you say only a minimum amount of people will be affected. It doesn't seem right, and maybe you'll tell me you won't be writing to the customers who won't be affected, because that would just create worry for no reason. So just want to understand the process of communication if the charges does occur.
I'll kick off on that one. You're quite right. There are differences, and these need to be understood. I think part of the consultation plan will be very much that we'll have drop-in centres within the Christchurch area. We might probably focus there a little bit more, but the aim is to have an even geographical spread. You're quite right that actually the number of individuals that are impacted will be small. However, we feel that if you only consulted with those people who were affected, what you're then doing is discounting a swathe of opinion of people who eventually might be in that situation. So we've got roughly around 4,000 clients who have a chargeable service at the moment, but there's about 11,000 clients who are known to BCP Council. Now, some of those clients may end up having a chargeable service in the future, so we feel it's only right and proper to consult with all of them. I don't know if Chloe wants to add anything more about Christchurch in particular. I know we've got some of the kind of focus groups and so on are active in the Christchurch area that we would absolutely be directing consultations to as well.
Yeah, and just to add that we work with our communications team as well quite closely with all the messaging, so that it's consistent and clear.
Councillor Rampton.
Yeah, thank you, Chair. I have two questions and a comment, if I may. My first question would be, will there be an opportunity for people to have a delayed implementation of the charges if it was felt that it would put them at a disadvantage? I'm assuming that wouldn't be in the questionnaire, but is that something that officers would have discretion to use? My second question is, where will the consultation results go? I know that we are recommending to Cabinet that we've noted the report, etc., but actually where will the consultation results go? Will we have a chance at this committee to look at the results of the consultation and comment before it goes anywhere else? And does it then go to full council? You hope so. Right, okay. Okay. Right, okay. So my first question.
Perhaps I can kick off in terms of any delay to implementation. As part of the consultation, we'll be asking people what they think the impact will be on them of these changes in charging. And that will help us to design any mitigating factors that we'd want to put in place, particularly if we feel there might be cases of financial hardship. So the answer is delaying implementation may be one of the mitigating factors we put in place. I don't imagine it would be a long delay, but we might want to give people an opportunity to come to terms with a different charge and prepare for it before it happens. So if there's a lot of feedback that suggests that would be a helpful thing to do, then that's something we'll think about, along with other mitigating factors. So it may well.
If I can,
I think you haven't answered the second question about where did the outcome of the consultation go.
Yes, the output consultation will be going both to the working group, also back to this committee and Cabinet as well. When it reaches Cabinet at that point, it will also have the draft policy, which will obviously be shaped by the outcome of those consultations. So it's important to have both parts of that puzzle together when we get to that stage.
And Chair, my comment would be that some of the charges for Poole, and particularly for Christchurch residents, are very, very high. And it's okay to say, well, it's only going to be people who can afford to pay, but we all know that people obviously can make choices. And if they or their families choose that they don't want to pay and they're staying at home instead, what is the impact on those people in terms of their social isolation if they choose to do that? So that's something we've just got to really keep in mind. Thank you.
Thank you. Jackie.
Thank you, Chair. I understand that this review has happened because of the harmonisation of the three councils, although Bournemouth had done theirs about this time last year. So how often does this the charging policy need to be reviewed to ensure that actual costs to the council don't fall too far behind? And will costs have already increased by October 2020? Because we don't really want to leave it so long that suddenly, if we leave it every 3 years, that there's huge increases for people each time. Small increases often is better than a huge increase, after a few years.
I think, in a sense, what we're doing today is setting down the baseline, and in common with the legacy policies, we would be recommending in the BCP policy that authority was delegated to the responsible service director to raise charges annually in line with inflation or in line with an increased cost of care. So it is something we would review and alter every year, but based on the baseline that we implement as a result of this charging policy change.
Louise.
You mentioned that the consultation might be delayed slightly, so I just wanted to check whether it would still be 8 weeks long.
Yes, it will still be 8 weeks long, yeah.
And the other question I had was about the letters that will go out to people. So for people who will be most affected by this, will the letter explain the impact on the individual that the letter's going to?
No, John.
Unfortunately, it won't, purely because as David is these things do fluctuate quite greatly over time. So actually, by the time you sent the letter out, something may have changed for an individual. So we don't want to fall into that trap. But also, because we've got 4,000 or so clients who are open to those chargeable services, that is a lot of work to go through to understand each of those individuals' position and therefore what the impact would be. I think we're going to make it very clear in the consultation, a little bit as shown, that at each point, if you are a nil charge payer, this will not impact you. If you are a full charge payer, this is the potential maximum. And I think we need to do some work to make sure that those kind of descriptions are really clear throughout all the documentation we send out, so that everyone understands roughly kind of what group they belong to and therefore what the implications may be for them. But to go onto an individual basis may be too much work that not then be worthwhile if things change in the interim, if that makes sense.
Do we have any further questions?
Thank you, Chair. And it's kind of Louise has covered it in many respects. But I suppose my only comment is a comment more than anything, is that I think it's right that it goes out to everybody. I think it should be as widespread as possible. I suppose my concern would just be that people get a letter through, anxiety kicks in, people don't necessarily read the finer details. So it's got to be absolutely, it can't be nebulous in any respect. It's really good, Pete, to hear that you're saying at every opportunity you're sort of reiterating that message. And I'd really like to say that I think that's really, really important to do that. So that would be my concern a little bit, because what we don't want is things to engender anxiety, and people who are kinds of service users, their lives are stressful enough as it is, so it's kind of just mitigating that. Be really mindful of that. That's my concern more than anything. But good work, thank you.
Thank you, Chairman. I was just going to comment that obviously we've talked about people attending day centres. What we would do is work with the providers of day centres, particularly Tricuro, who would see people on a very regular basis. So this is about ensuring that we work with providers of care also, so that they're able to support if anyone does have any particular anxieties or concerns. So just to assure that we would be doing that in conjunction, and we would be working with providers if they're picking up that anyone is anxious or has particular concerns.
And can I just also add that for the drop-in sessions throughout the consultation, our aim is to go to the day centres so that we have these drop-in sessions at those day centres where people have been mostly affected. So hopefully that will help.
Councillor Edwards?
Thank you. The answer's probably in the paperwork somewhere, so forgive me, but are we adopting the transport costs will be separate to the daycare charge? And I've got a second question after that.
Sorry, should I answer the first? Sorry. Yes, no, you're quite right. One of the questions that will actually be teased out in the consultation is whether or not the transport costs should be included in the day centre overall. The working group had a very interesting discussion around the environmental impact and how that may or may not drive behaviour. So that is a question that we would be asking, and then we'd be reviewing after the consultation is complete.
And my other question is about the deferred payments. Can you tell me, it says that the loan which the local authority secures against an individual's home at a fixed interest rate. Is it all right for you to tell me what that interest rate is? And what are our annual fees that we charge the people on their homes? Thank you.
I'm afraid I don't have the interest rate to hand, but I can make sure that I get that and circulate that to committee after the meeting. In terms of the annual fees, currently an annual fee of £100 is charged in Christchurch and in Poole, but we don't have an annual charge in Bournemouth. And as I say, the administration is quite substantial for these agreements on the yearly basis. Similarly to the set-up fee, the set-up fee in Christchurch is actually greater. That's currently £804, and in Poole and Bournemouth it's £500 each. We believe the £804 is actually closer to the actual cost to us. And again, as with all other charges, there's no profit here. This is the actual cost to us of running that administration for those agreements.
Councillor Rampton, did you have another question? Oh, okay. Does anybody have any more questions? Oh, yes.
No, it's not a question, Chairman. If you finish the questions, has anybody got another question? No. I just want to say, on the topic of the transport, I was really pleased to see that the working group had taken on board the environmental impact of everybody going in their own car or being taken in their own car. So I think it's really a step forward to embrace what the Council's trying to do. And the other thing is that I think that the principle of the full charge, of the cost being the charge, is I think we've got to stick to that. And obviously I'm very aware that the reason Christchurch was subsidised was because the tax was different. And I think that's, as the Council was saying, it's got to be somehow put over that this is a new policy and it's got to start in October, and I think we'll have to just get over that one politically. But I'd also like to thank you for doing so much work on it. It's really very professional, I think. Yeah, thank you.
Okay, thank you. I'm just going to update the committee on the progress of the Adult Social Care Charging Policy Working Group now. As you'll remember, a working group was established by this committee on the 22nd of July in order to provide test and challenge, as well as contribution to the development of the charging policy harmonisation proposals. As a group, we've been considering the equity and clarity of the proposed policy, as well as the plans to take these to public consultation in a way that's comprehensive and accessible to all service users and carers. At the meeting on the 22nd of July, this committee commissioned a working group of 6 members, including 1 external member, Louise Bate of Health Watch, myself, Louise, and councillors LJ Evans, Karen Rampton, Jackie Edwards and Chris Matthews met for our first meeting on the 3rd of September. For the first working group session, we were informed that the predecessor councils had set charging policies for the financial assessment of clients who received the adult social care, and that BCP Council was required to update and harmonise its charging policy by April 2021. And we were given the overview of one of the financial assessment models as an example of how the council assesses the level of contribution each user should make towards their own care. As a group, we agreed on a set of principles that would allow the officers to set a time schedule, as well as provide officers with a framework to develop the policy. And these principles included that for existing charge, where there was a charge raised in any BCP area, it would be applied across all of BCP. Where charging harmonisation takes place, it would be to the level of the highest existing charge. That charges would be made with a full cost recovery basis. And for the introduction of new charges, that proposals will only be developed for new charges that are already applied by other local authorities. Proposals would not be developed for new charges that would cost more to collect than the potential raised income, and that proposals would not be developed for new charges where more than 50% of those who would pay it are subject to safeguarding, and that proposals for new charges would be based at full cost recovery. Following discussions, the group encouraged officers to hold a longer consultation period than the proposed 6 weeks, and furthermore we requested additional information and detail provided on the financial impacts and the outcomes that would arise from the developing policy along the agreed principles. Our second meeting took place on the 16th of October, and we worked through the list of the harmonisation proposals that the officers had drawn up since the first meeting. The proposals had been broken down into individual service costs, which included, for example, self-funder home care setups, out-of-area care assessments, deferred payment agreements, and others that we've heard about. We've covered a lot of what I was going to say already in what you've updated with us. We agreed that the questionnaire would be open for 8 weeks from the beginning of January to the end of February, and we're pleased to hear that there'll be drop-in sessions held at libraries, day centres, including during the consultation, and that DOTS Disability will also run sessions. Louise from, I don't know why I've suddenly referred to you there. Members have emphasised that the consultation and explanatory letters are clear, honest, easy to understand and accessible to everyone. And so officers have informed us that letters and questionnaires would be sent by letter to all service users and carers in the area, and that it would be open for all members of the public. The group have requested sight of the questionnaire before it goes out to the public and the ability to comment on the draft. And I hope that we will have the consultation dates for all of us so that we can go along to some of these events as well as members of this committee. Our next meeting will be held in April, May time next year, where we will have the consultation feedback and we can analyse the response. And from there, we'll look to further development of the policy with intention of BCP Council authorisation in early summer 2020. Is there any questions on that? No. Great. Okay. I think we finished that item then. Thank you very much. Item 8 is to receive a presentation on the Dementia Services Review and proposed new model of care. And this item is going to be presented by Diane Bardwell from Dorset CCG, Dr. Paul French and Mark Harris. are also available to answer any questions on the update. And it's recommended that our committee note this report. Thank you. That was a really interesting presentation and I think very hopeful for our residents. Do we have any questions? Jackie.
Thank you, Chair. Actually, I haven't got a question. It was just a comment, actually. I'm so pleased to see that you're going to look after the carers because they are absolutely vital for these dementia sufferers because it's somebody that they know and are familiar with. But looking after someone with dementia takes a toll on your physical and your mental health. So I'm really happy that that this has been recognised, and I hope that access for the support services will be readily available for these people. So, thank you.
Chair, how confident are you that you'll get the funding? Obviously, report shows that. You mentioned 17 million if people need beds and whatever, so it's good value, this 12 million. So are you pretty confident you will get that?
Thank you. I suppose, as Di said, the governing body have approved the model of care, so we are confident, but obviously it's all subject to the long-term plan financial settlement, which, as Di has also mentioned, you need to wait till after PERDA to get the final understanding of what we can actually invest in. So it's difficult for us to just say yes or no at this moment in time.
Did you have a question?
I was just going to add to that.
Yes.
I'm the director of the portfolio for.
Thank you. Jay?
Thank you, Chair. First of all, I just want to say congratulations. I think this is an amazing piece of work that's been done and such an opportunity to really improve dementia care for Bournemouth, Christchurch and Poole. I know this report's just for information, but I was a little concerned about the lack of mention of primary care in any of the model. It really only seems to come in at the beginning and then gets ignored. I wondered if...
It's so the primary care element, the dementia coordinators will be based within primary care networks, which are primary care. The memory assessment service, what we also will be doing is aligning those with primary care networks that will be much more primary care focused. So actually people... Probably, there's only a very small percentage will end up in secondary mental health services, as they are currently. There's quite a small number. And those people that use community mental health teams, they actually do get currently discharged from the service. So what we're offering is a primary care focused service with dementia coordinators, but ongoing. So they're discharged, which is what people really wanted. They don't want to be discharged, and they always want to know. Even if they don't necessarily want to use the service, they want to know that there's a point of contact if there's a crisis or anything that they need to ask. So I think the dementia coordinators will be really exciting for Dorset.
Can I just add, I think there's also an opportunity here for us to develop local services. The PCNs are obviously mainly linked to localities, areas of different demographic needs. And so what we can see is that we can use the local resources, such as the dementia-friendly communities we have in Southbourne and Christchurch, very strong dementia-friendly communities. I'm sure there are others, those are the two that come to mind. But we can link in with those, with the dementia coordinators, and I think also small voluntary sector organisations, small leaders within their own community can begin to have an impact on what's happening locally. So I think it's very exciting from a care perspective.
Councillor Kelly.
Thank you, Chair. You might have actually partly answered this, Paul, I'm not sure. You mentioned that the Alzheimer's Society contract will come to an end. All the services they have been providing, those will be incorporated into your new plan, is that right? It's slightly different. Basically, it's more robust what we'll be offering in the future. So at the moment, Memory Support and Advisory Service, it's quite limited actually what they offer. So they offer a screening before a person has a diagnosis, and they offer some support at that point. However, what we'll be having is a more robust screening process, and probably a more efficient one, by having registered triage staff rather than unqualified. So that will be a much quicker process, because at the moment they people go through the Memory Support and Advisory Service, then they go to Memory Assessment Service. People have told us very clearly that isn't what they want. They want to go straight from the GP straight into an assessment. So basically the post-diagnostic support element, and at the moment, and this is because of the sort of capacity within the Memory Support and Advisory Service, but also the way the service has been set up, they offer a little bit of post-diagnostic support, but very different from what we're going to be offering in the future. So again, it's much more enhanced.
Councillor Rampton.
Yes, thanks, Chair. In Paul, previously, we've had sort of training sessions, workshops on dementia, and that might be, once you've got your money, it might be really interesting to hear more about this for all councillors. Thank you.
One of the things we've been talking about is actually how we offer, how we look to, as part of an action plan, develop some dementia briefing for all members, and it's a good opportunity to just mark with CCG colleagues that actually to think about doing that together would be a really good way forward.
Councillor.
Another one about the dementia directory. What is actually going to be on that, and how would a member of the public expect to be using that? Thank you.
We've currently got one. We designed and developed it a number of years ago, but what we have done is updated it, and we've never sort of had it as a concrete anything, really. It was just something we managed to leave out of bits of money. But people have felt it was really important. And also, people want hard copies. I know there's always a push, everything to be web-based, but you know, we have got an older generation. I mean, my mother always reminding me that, you know, she has no computer. She wouldn't know how to turn one on. So the hard copies we're continuing, and we've costed that in. So the dementia directory is available at the moment. But if you have a look on our website, it's there, and I think it's on the local authorities as well. And it's promoted, and it gives a whole range of different community services around dementia, but also gives some basic information of where people need to go to and signposts. So what the plan will be to update that sort of on an annual basis, and to do a print run as often as we can. So it's been very well received up till now. So.
Did you have another question?
Yeah. Actually, it was just a comment on a paragraph that just didn't make any sense when I read it. It's paragraph 7.9 on page 40 of the full agenda, and it just says it's estimated that the direct cost benefit will be 2.2 million per year, although not all will not be cash releasing.
I wish it was. It's basically the system wouldn't necessarily be able to release the money fully. So there would be, whilst it would show there would be a cost benefit, it might be difficult to extract that money physically and put it into our dementia services, although it would be wonderful, like I said, if we could do that.
But I think it's just a typo in the board,
Okay.
that's all. Thank you.
Do we have any further questions? I think we'd just like to wish you well in implementing this, and perhaps in 2 years we could have you come back and tell us how it's going. Is that okay? Okay, thank you very much. Item 9 concerns the quality accounts of local NHS organisations and the process involved to ensure that the Council responds to quality accounts of local NHS organisations. Elaine Stratman, the Principal Officer in Adult Social Care Commissioning, will introduce this item. And following Elaine's input, we'll be discussing... well, actually, I'll leave that until after you've done your part. Thank you.
Good evening, everybody. Yes, I just wanted to give a brief overview of NHS quality accounts and the purpose of them, really, and also the proposal going forward for scrutiny of NHS quality accounts and whether that's agreeable to the committee, really. So, NHS quality accounts. So, every year around April time, NHS trusts provide a quality account which sets out a number of priority improvement areas that they've been working on over the year, normally 3 to 5 that they set are main priority improvement areas for the year. They also report on quality indicators, CQC, registration and inspection, clinical audits and research, as well as a number of other things such as customer feedback, information governance, etc. The Francis inquiry, which was conducted over 2010 to 2013, looked into serious failings at the Mid-Staffs NHS Foundation Trust. And one recommendation coming out of that report was that quality accounts should contain observations from commissioners, overview and scrutiny committees and Health Watch. More recent guidance, which is a bit more of a lighter touch approach, is that overview and scrutiny committees should be cited on quality accounts and have a chance to comment on them. So the proposed approach that we would like to put forward to you is that the scrutiny of 4 quality accounts for the trusts of Dorset Healthcare, Poole Hospital, the Royal Bournemouth and Christchurch Hospital, and also South Western Ambulance Service. And the proposal is that 2 members sort of align themselves to a trust. So therefore you build up that relationship, that partnership, working with those NHS providers. So 2 elected members would go out with an officer, a responsible officer, quite often myself, to visit these trusts, normally twice a year, to have a conversation about priority improvement areas, what's been happening over the last year, any areas of concern, and any areas elected members particularly want to raise with the trust, and have a meaningful discussion and scrutiny around what's been going on. Towards the end of the financial year, so around March, April time, NHS quality accounts, the trust send the accounts out to the Overview and Scrutiny Committee for comment, and quite often the report will come to myself and I'll work with those officers, those nominated officers for each of the trusts, to look at what kind of formal response we want to give. And at that point, the chair of the Overview and Scrutiny Committee then makes a formal response to each of the trusts. And the formal response forms part of the quality account. So that is a published document within the quality account. So I guess that's the proposal, really, is 2 elected members for each trust willing to go out and represent the committee to scrutinise quality accounts and raise concerns or any comments or issues with NHS trust providers.
Thank you. Does anybody have any comments on that approach? The first.
Just declare an interest at this point, please,
Oh,
a
of
belated
course.
interest as a staff nurse at Royal Bournemouth. Thank you.
Thank you.
Actually, yeah, that was something I wanted to raise, Cheryl, because obviously there's a few of us who work at different trusts. Would it be for us to scrutinise those trusts, or would it be bad for us to scrutinise those trusts? What do people think?
If I just commented, I think probably it is an external eye of the elected member that's being looked for, so I would think it would be very difficult to have that relationship with the trust which employs you.
Okay. So does this committee agree that that is the right approach to take forward?
Sorry, one further comment. Do we need to scrutinise Dorset Healthcare at all, just because some services are provided to pool residents in particular, depending on the sort of postcode lottery that can fall on the boundaries?
Sorry, yes. Dorset Healthcare is one of the proposed trusts, yes.
Sorry. Not Dorset Healthcare, Dorset County.
We haven't taken that approach in the past, to be honest with you. But would welcome comments around that.
I think that residents can actually be referred to numerous hospitals all over the country, so we should probably stick with the ones that are within our area, I would suggest. Yeah.
Sorry. I mean, I would imagine anyway, Dorset Council will be very much interested in, what's going on at Dorset County Hospital. So I would imagine, and certainly feedback, representation from them and what their findings are, if that's of interest to the committee.
Sorry. So, for balance, would there be any point of joint scrutiny with Dorset Council for some of their trusts? Because obviously they will be using a lot of services over this side of the county, especially once the CSR changes go through.
We have tried a similar approach in the past, and to be honest with you, it was very, very difficult to align the meetings. However, we are willing to explore that if that's what elected members would like to see happen. We can certainly try that. And you're right, it's efficiencies as well, isn't it? If we're all going out to the same meeting rather than that trust reporting twice, absolutely.
So are we agreed with that as a way forward with this? Yeah. The 4 trusts, it would be we would need 8 of our members to commit to looking. It is really, yeah.
I ought to say I'm sorry I was late, first of all. The second thing is I'm subbing for Councillor Allen, and she does, as you probably know, work for Bournemouth Hospital, so she would be out of the equation for that particular one.
Sorry, did you have a question?
No, I didn't have a question, but if we're going to go through with this, then I'm quite happy to volunteer myself for the Royal Bournemouth and Christchurch Hospital Foundation Trust, as I don't work there.
I think what we'll do is we'll do it by email, and Sam will send out an email to us all to see who's interested in particularly any particular hospitals. And I think when it comes to the AMPS Trust, it may be more of a virtual...
Yeah, because of the geographical area of the trust, it has been difficult to actually visit them, so we can try and set up some kind of like teleconference or Skype call with them, if that's more convenient.
Yeah.
Yeah.
So if this committee is in agreement, we'll leave this to Sam to pick up after the meeting. Is that okay? All right. Thank you. Thanks. So item 10 concerns the annual report on complaints and customer feedback, and the committee will receive reports from the preceding Bournemouth and Poole councils on the 2018 to 19 survey outcomes regarding adult social care complaints and information on how BCP Council is managing the statutory complaints process for adult social care. And we'll hear from Elaine Stratman and Nikki Mitchell. The recommendation is to consider and note the information and any actions of issues to consider for the forward plan.
Oh, would you like me to try?
Thank you. That was a great insight into the complaints and compliments. Do we have any questions?
Chair, I did email Nikki from a Christchurch point of view that we need to keep on challenging Dorset to give us information. I believe you did go back and you did get some more detail, so I appreciate that. Obviously, looking for consistency, the Bournemouth and the Poole report is different. I think it's a Poole one where the lessons learned are clearly signposted, so that was great. And similarly, I think whereas Bournemouth probably have thank yous are a compliment, whereas Poole spread that out. A thank you is a compliment, so take them. So that's it. And the question is, it's said there's no time scale for responding to complaints. Is that the way correct?
There is a timescale, but you can actually set it locally. There's a statutory timescale. You have to acknowledge a complaint within 3 working days. However, we've set a local timescale for responding to complaints. So these are complaints that we deal with as local resolution. So these are complaints where we, like practice manager or a manager in general, so the operational manager will respond to a complaint within 20 working days. However, if we need to go on to a more detailed investigation, these often take longer, so we have to agree them with the complainant for a complaints plan. Yeah.
Andrew?
Thank you. Number of comments. Firstly, when you looked at the demographics of the complaints, particularly relating to Bournemouth, why was the white Irish population, any other black as they were designated, and women, why were they all disproportionately high? Does this show any evidence of discrimination, or is it for some other reason? Thank you.
That's a good question. That's something, unfortunately, our Bournemouth complaints manager couldn't be here this evening as she's unwell, but we can certainly find out a bit more about that for you, because we wouldn't know the detail of those individuals.
Yes, and I'll
Yeah, we do have some complainants that make a number of complaints every year, and we also have an unreasonably persistent complaints process that we do sometimes use that, not very often I have to say at all, to manage some people's complaints, because otherwise we do tend to go round in circles. You know, statutorily we're not allowed to answer the same complaint twice. The process is, once we've answered a complaint, if the person is still not happy, they go to the LGSCO and for an independent review. So that's what we would refer them. But generally, those complaints are from individuals. Like, we do have a few people that complain a number of times, but not many.
I have a question. Do all complaints get registered as complaints? So is there, could there be people who have maybe phoned up and they may consider that they have made a complaint, but because they haven't actually done it in a formal way, it's not picked up and doesn't make the statistics?
Yeah, that's why we have complaints training, is so all staff are aware of what to do as soon as they get a complaint, and that they refer them to our team so we can pick it up under the statutory process. Inevitably, some things fall through the net, but we do pick it up quite often a bit further down the line, or if something can be resolved within 24 hours, that might not necessarily be recorded as a complaint because it's something that's been dealt with under a normal care management process. We also have a large number of what we call concerns or representations. things that people will come to us and they'll ring our team and say, I'm not sure I want to make a complaint. In fact, I don't want a complaint. I just want something to happen, or can you advise me who I speak to? And sometimes this might be a health service or a safeguarding incident instead, or we can pass it to care management and they'll pick it up and it'll be dealt with. So the complaints that are recorded, there's an awful lot more work that goes on besides that to offer people support. Because some people don't actually want to make a complaint, they just want something to happen. So does that answer your question?
Thanks, Chair. There are a lot of red arrows, particularly for Poole, and I'm particularly concerned about the carers survey. And obviously I note that the actions that you're taking, I suppose my question would be, are you taking those actions in consultation with the carers? Have you gone to the carers and said, what are we doing wrong? What can we do? How can we do it better? And have you come to these responses in consultation with carers?
We did look at, you're right, you're absolutely right, the carer survey we were concerned about. So what we actually did is we actually drilled down quite deeply to find out where the concerns were, particularly in Poole, in regards to things like information and advice, because that had really taken a nosedive. And from that, so therefore we picked up by client group what was going wrong, or perceived client group for the carer. And there was particular areas where that was more in play, more than other areas of client groups. So a lot of targeted work was done with particular client groups. And I don't know if you want to explain a little bit more about that, Nikki. Is that okay?
Yeah, I mean, we talked to the commissioning manager of the particular client group, and there was already work going on around information advice, and they had, with the partnership board, already some little action groups that were going on. And I haven't unfortunately been able to go yet, but I'm planned to go to one of the meetings to sort of discuss what the comments were in the survey and what they've already actioned and what they need from the information and advice. So yeah, we do try and drill down into what the comments and what the surveys are telling us so we can make improvements.
But you've just said you're talking to the commissioning managers, but are you talking to those carers and the people they care for? Because that's the voice you want to hear. One more comment, Chair, which is just really pleased with the feedback for the START service. As ever, we've got an outstanding service and really hope that we can keep that. Thank you.
Councillor Evans?
Thank you. Just a comment, Elaine, you said we were given the quality of life score compared with the South West and the UK. I couldn't actually see that on the Bournemouth survey.
I didn't put it on the slide because I didn't want to overwhelm people, but I can certainly send that out with the minutes, what the national scores were. Would that be helpful? Because I don't happen to have them on me at the moment, but we can send them on.
Thank you.
Is that okay?
That'd be great. Yeah, because I know the maximum was 24, we'd get around 19.
That's
but it
right,
was very difficult to work out if that was good or bad.
Yeah, and it's calculated different for the carers survey as well. It's a very different calculation. So yeah, we will send those on to you.
Thank you. Second question, obviously we're harmonising post-LGR. Are we going to harmonise the surveys before they're next sent out, please?
Yeah, Nikki's our lead on that, and she certainly is working. We're working as BCP. The surveys, you're absolutely right, will be sent out as for BCP resident survey, yeah.
Is that going to make comparison next year difficult?
It will make it interesting, yes. Yes, but as ever, with any survey we do, we will absolutely drill down and find out what the issues are, because it could actually mean it harmonises the scores a bit more. So where one might be an outlier in one area and one's actually performing really well in the other, it could equalise things, couldn't it? So we will be drilling down and looking deeply at what the survey results tell us.
Councillor Lewis?
I was just wondering, looking at where the survey was sent
to all adults in receipt of long-term support services, etc., and there was a 44.7% response rate. With the carers, was that all the carers that responded? Because it doesn't actually say what the rate was.
Apologies if it doesn't say. We generally have a higher response rate with our carers. Again, we can circulate that afterwards. No, it doesn't for the full one, but I can't remember off the top of my head, and I don't want to say and guess in case I'm wrong, but it is generally a high response rate. We do send it to all the carers, and we do generally get a higher response rate.
No, I was just a bit concerned about the I have as much social contact as I want with people I like being so low, and I wondered if, something could be done. Or
again, yeah, we do pick up these things for improvement, and there is always projects going on. There are the stuff around tackling loneliness going on at the moment that our commissioners are looking at. So it's a very difficult one to tackle, and I think the question, is some people will say they're lonely. We have done some drill down work before where we will look at those individual cases for the people that say that they feel extremely lonely, and a lot of the issues can be about stuff that we can't change. Often we will offer someone a package that might help them go to a day centre, but they just don't want to go, or they've got mobility issues that means that they don't want to go. So those sorts of things can be very difficult to tackle, but we do try and drill down and get to the bottom of why people are saying what they're saying and what we can do about it. Okay.
Thank you. Is there any more questions? No, I think then we're just going to note the unless there's any actions to consider for the forward plan from anybody, but maybe just something to keep in mind next time we discuss it. Okay, thank you very much. Item 11 concerns the Cabinet Performance Report, and the purpose of this item is to scrutinise the health and social care elements of the Cabinet Performance Report and discuss how this could link to the Adult Social Care Strategy. And we'll hear from Jan Thurgood on this.
Thank you, Chairman. I'm just going to comment on, I'm just going to probably take you through page 1 of Appendix 1 of the report. So that is the page with the Adult Social Care Performance Indicators. So a couple of reasons for bringing this, one of which is we have had to look at a range of indicators and identify a range of indicators that we felt gave you a kind of perception across, a view across adult social care. So one thing over time, committee may say to us, why aren't you reporting routinely on X or Y? One of the things you've just heard, that one of our major ways of telling we're doing is the surveys. But actually they don't work, of course, for a quarterly reporting, because they're either done once a year or they're done, in the carers case, only once every 2 years. So just bear in mind that the surveys are in addition to these quarterly reporting. So this is the basket of indicators that we have currently chosen, but as I say, committee may want to, over time or today, say, why aren't you reporting on X or Y? I just wanted to have a few comments about because this is the first time that we've reported give us feedback, so some people will not have not be able to give us feedback, but that's a reasonable position. We were trying to look at something that measured our responsiveness. So we've included the timeliness of delivery of aids within the home to support independent living as a kind of view of are we giving prompt responses, and as a review of what we know is a very important service to the public. The provision of equipment and equipment in a timely way can really change someone's discharge from hospital or ability to cope. So that's a measure we think is important. As you can see, we didn't have the Q2 data in time for Cabinet. The proportion of carers who receive information, just to explain that the two figures are kind of very dissonant, and then our forecast looks absurd in the light of our Q2 performance. This is about our initial problems in data, and actually, as you can see, our performance, when we've got the correct data, much higher. But again, we do think that the provision of information, and actually it's interesting that Councillor Rampton picked up from the Pool survey that issue for carers about not getting access to good information. So we think that is a really important indicator for our carers. And interesting, actually, in the dementia presentation we had earlier, how important it is that carers, that the people who are looking after someone with dementia can have information and support readily at hand. And the final two are things that we really feel we need to prioritise in the adult social care strategy. As committee will know, we're going to be consulting on an adult social care strategy and bringing that back to committee before it goes to Cabinet. And when you look at our initiation, both for adults with a learning disability and paid employment, and also for adults with a learning disability and settled accommodation, we are not performing well in relation to the English average, and we think that that is an area that we really need to improve. Neither the predecessor councils, none of them were performing well. I don't think Dorset were either, in relation to employment. Interestingly, in Poole, there was an above average performance in relation to settled accommodation for people with a learning disability, and not so for Bournemouth. So one of the things that we will be looking at with housing colleagues is how can we increase the range of tailored supported housing for people with a learning disability, and how can we really look at how we progress that form of independent living. So I wanted to highlight those because we will be, as we bring through the adult social care strategy, they will be two elements that we'll want to ensure that we've got really robust planning around, because you can see that the performance at the moment is not where we would aspire to be. When you go further on, the next one is children's services. So we had 7 indicators.
Great, thank you. Councillor Trent, have you got a question?
Well, yeah, it's regarding the last two on that page, the adults with learning disability and paid employment and in settled accommodation. The paid employment thing is of particular interest because at one time we used to provide opportunities for people with learning disabilities to work, thinking at Upton House, for example. And at the moment, the only obvious place I see at the moment where people who I'm assuming have learning disabilities that are working and are actively visible is one of our local supermarkets. And I'm wondering whether there's anything we should be doing as a council to kind of create these opportunities for people, particularly with our, sort of open spaces and sort of leisure facilities, whether we can actually maybe look at coming up with some kind of scheme to repair the difference.
So I think what we will absolutely want to do is to examine this in detail and look at what will be the most effective strategy. I think you're right to draw attention to we are a big employer. We are a big commissioner as well. So we will want to think about how do we... There's two things we probably need to think about is how do we ensure that ourselves as an employer and other employers are able and willing to take on people. The other bit is how do we support people into and in employment. So we'll need to think about that carefully, but I think you're right to point out we are a large employer.
Thank you, Chair. Can I just make a comment on that? There is an organisation called Crumbs who train people with learning disabilities, mainly, I believe, for the hospitality industry, and they run their own business while doing outside catering. But one of the things that they've said is that some of the people that they train there actually don't want to work with the public. They like to be behind the scenes. They don't have the confidence to sort of work on a face-to-face. But it'd be worth, if you're going to discuss this, have someone from people like Crumbs come to talk to us.
Is there any other questions?
Thank you, Chair. It's just a question on like homelessness, rough sleeping, which I think is obviously related to social care. Now, there's a couple of indicators under the environment and community about homelessness, but should there be a score for rough sleeping?
I'm happy to take that back as a comment to housing colleagues and have a discussion with them. As members will probably know, there is an annual count of rough sleepers, but we'll take that back to housing colleagues, because sometimes we've been trying to look at how do you get measures which make sense quarterly. But we'll take that back to housing colleagues. We can do that.
I was just thinking, obviously, it sits within both directorships, really, because a lot of cases relate to care issues, and that's why they're rough sleeping. But I appreciate that. Thank you.
Yes.
Can I just say that actually was discussed at Cabinet in a sort of, an informal way, that there is such a link. So that was exactly what we were saying. And the portfolio holder for housing has actually been out on a mission, I don't know what you call it, going round and seeing what's what. So, and he said, that there must be a link. So yes, we were looking at that. So obviously I'll get back to Jan on that.
Is there any further questions? I think in that case we are just again going to note the Q2 performance levels. Yes. Thank you. Okay, item 12 concerns the forward plan for this committee. Do members have any comments on the forward plan? Yes.
I suppose one of the issues that would be good for if the committee can just give us a view on is the issue of the two items which are down for the potential for joint committees, joint scrutiny with Dorset Council's committee. That I understand, looking to Sam, I don't know whether you want to comment at this stage on those two items and what Dorset's committee is doing as well.
So really, at this meeting, it would just be good to gauge whether it's something you would want to move forward with, and it's the same as what Dorset County Council is doing at their overview and scrutiny meeting. Once it's agreed that it's something that committees want to move forward with, we'll be looking to update the protocol for joint scrutiny working. So that would be the next step.
It's the
ones at the very bottom. So it's the
South West Ambulance Service Trust Improvement.
And 1920.
Yeah.
And they are separate.
Are we agreed that we would like to pursue that line of inquiry? Yes? Yeah. Great. Thank you. So is there any other comments on the forward plan? No? Great. Okay. Okay. And the final item on tonight's agenda is to look at future meeting dates. If members can please note the change of location as listed, which is that the next one is at Christchurch and the following one is at Bournemouth. Yes, great. Okay, thank you. Yes.
Sorry, I just want to make a comment about that. Can I ask how many of us actually come from Christchurch? One.
And Nick here.
I'm very close. It's just that, you know, most of us live sort of Bournemouth, sort of Poole way, sort of going all the way over to Christchurch. And I just would be happier having them either in Bournemouth or in Poole for most of us. For people from Poole getting across to Christchurch at this time of night, it's just a nightmare.
Absolutely, and getting from Christchurch to you. But I agree, there are more of you than there are of us. We've always said.
It was just a thought. I mean, if you say how many are from Poole having to go to Christchurch, it's quite a trek.
I did check, and the Phoebe room in Bournemouth would be free for the next meeting if members would want to change to that location.
Do we? Oh, Tony, sorry.
I would make a comment actually that it wouldn't be such an issue travelling either from Christchurch to Poole or Poole to Christchurch or Bournemouth to Christchurch or any of the longer haul ones if the meeting started at a slightly more considerate time, because unfortunately starting at 6 p.m. means that you travel in the rush hour. And my first experience of getting from Christchurch back to my very easterly part of Poole, Wallistan, we did some planning training, was 1.5 hours travel, which was absolutely diabolical. And other people have experienced similar things. But that would have, if the meeting, or if the travel time had been about half an hour later or something like that, it would have made all of the difference, or an hour later, even better. But travelling at the peak of the rush hour strikes me as something that we should be avoiding. And, you know, we would... I'm sure we'd all get to the meetings in much better condition if we didn't have to sit in traffic and just generally get stressed out.
Mm-hmm. I think point taken, but I think we also have the officers to think about and the time. I think either way people are inconvenienced and it's difficult for different people. However, do you want to propose that we move to Bournemouth for the next meeting and we could put that to a vote?
I'm quite happy to propose that the next meeting's moved to Bournemouth, yes. But I think we have to bear in mind some people working here that, you know, they can't suddenly take time off at 3:30, 3 o'clock in the afternoon. At 6 o'clock is, even then's a difficult time. But yes, I propose that we move our meeting to Bournemouth.
Do we have a seconder for that? Okay. All in favour?
1, 2, 3, 4, 5, 6, 7.
All against? And abstentions? Okay. All right. So that's the next meeting is going to be in Bournemouth. And then does somebody want to propose that we change the time?
I'd like to propose that we consider a later time. Ideally 7, but 6:30 would be a compromise.
Can I just find out what difficulties that would cause for officers if we were to change the time, whether or not that's even realistic?
I just think I'd probably like to take a view about consistency across the authority, just in terms of I think most committees are meeting at 6, or are they? They are. So, yeah. So I think there is a consistency issue, and I think I think if we had an expression of what members think, that would be helpful, and then I would want to take it back and have a wider conversation about consistency and what that feels like. I mean, obviously there is an issue in this committee, not only council officers but also officers, particularly from health, where people may have worked from 8 or 9 in the day, and we are in this committee not only talking about our own officers, we are talking about officers a lot from the NHS and clinicians on occasion.
Yeah. do we have a seconder for your proposal there? No. Okay. All right. Yes. Yes.
I really feel that I don't know how logistically we do this, but maybe we need to start thinking about embracing technology so we can start using Skype and other kinds of how that works in reality when you're visiting and stuff. But nevertheless, it just seems that something going forward, just as all councils perhaps need to start thinking about.
Thank you. With that, though, I'm going to close the meeting. Thank you very much to everybody for coming.